This segment, our topic is health, and our issue is angioma awareness. Our guest is Connie Lee, and she's the founder of Angioma Alliance. Thank you, Connie, for joining us.
Thanks for having me.
Okay, what exactly is cavernous angioma?
Right, it's a hard word to say and a hard word to remember. Cavernous angiomas are blood vessel abnormalities. They look kind of like raspberries or mulberries,
Okay.
so they have a bunch of little caverns, and they're in the very smallest blood vessels. They're in the capillaries. They're not in arteries that shoot heavy blood, and they're not in veins that send blood back to the heart and lungs. They're in the sort of in the mix in between where blood transitions. For the illness that Angioma Alliance, my organization, deals with, the cavernous angiomas are in the brain and in the spinal cord for most people. People can have them anywhere, but really one's in the brain and in the spinal cord. It's a separate illness, and it's what we focus on. And a cavernous angioma isn't supposed to be there. It can happen just in one cell in your body going crazy and in your blood vessels and turning into a cavernous angioma. Or for some people, for about 25% of people that have this, it can be a genetic disease where their parents have it or one of their parents has it, and then they have it and they can pass it on to their kids. And it's actually, if you've got this genetic form of the illness, each of your kids has a 50-50 chance of inheriting the illness. So it can get pretty widespread in families. And when you have the genetic form of the illness, you usually have multiple cavernous angiomas spread throughout your brain and down into your spinal cord. The people that we hear about with cavernous angiomas in the news, we don't hear about them very often. But one of the famous people that had one was the track star Florence Griffith Joyner. Do you remember who she was? She was an Olympic runner in the 1980s, and she actually passed away from a seizure that she had in her sleep as the result of a cavernous angioma that she had. We also know that the person who has won the Tour de France 3 times since Lance Armstrong retired. His name is Alberto Contador. He's a Spaniard. He had a seizure during a race back in 2005 and collapsed, wound up having brain surgery, but came back and came back to win the Tour de France. So,
tell us a little bit about the symptoms. Is this something that can be found early in someone's life?
Yeah, you know, the symptoms run the gamut. More people than not have no symptoms and never know they have one. They only find out if, in some cases, because they wind up having an MRI, a magnetic resonance imaging, for some other problem. Say they got in a car accident and they happen to have an MRI because they hit their head. Those people are the lucky ones. Other people have headache from it. Most people that present with a cavernous angioma will first present with headache. Some people have seizures. About a quarter of the people that have a cavernous angioma will wind up with a seizure. And then other people have deficits that you would associate with stroke. So weaknesses on one side, blurry vision or double vision, difficulties with speech, difficulties with walking. It really depends on where in the brain the cavernous angioma is. That determines a lot what the symptoms are. And cavernous angiomas are not quiet little entities that just sit there and do nothing their whole lives. They can hemorrhage, and when they hemorrhage, they grow, or they send blood into the surrounding tissue, the surrounding brain tissue or spinal cord tissue. And so you get these periods of symptoms, big symptoms, and then gradually the symptoms get better. And folks that have hemorrhages tend never to get back all the way to baseline, but they do get some restoration of functioning from what they had before. So with cavernous angiomas, the symptoms aren't the same even necessarily in the same points of the illness. You can get variation in them.
Okay. So how common is this in the Hampton Roads area?
Well, it's actually common, and as I said, most people don't know that they have one, but we know from autopsy studies that really, if you look in people's brains, if you were to like go down the street and do an MRI of everybody that's in the downtown Norfolk, one person in 200 will have a cavernous angioma. So all of us know people that have cavernous angiomas. It's just that those people may not know they have a cavernous angioma. We think it's more likely that about 1 in 15,000 people actually winds up getting diagnosed. A lot of people present with headache and never get a good diagnosis. Like I said, a lot of people never have symptoms, but then there are some people where it continues and the symptoms get bad enough that they get imaging and they get correctly diagnosed.
Well, my thought is if someone has a headache, they're going to take something for the headache. So with CA, does this, if they take something for their headache, will it go away?
Unfortunately, it depends on what they take. If they're taking Tylenol, that could help, but normally people that have cavernous angioma headaches have headaches that are more than what Tylenol can help. If they start taking blood thinning products like Advil, the ibuprofen products, or aspirins like Excedrin, people take those for headache all the time, but they could potentially make things much worse because they thin blood, and so people having a hemorrhage are in the middle of bleeding, and if you thin their blood, then the bleeding can get that much worse.
Oh, wow.
Yeah, so it really can become life-threatening if you don't know that you have it and you start popping aspirin. That's how people wind up getting into the most trouble with them.
Tell us a little bit about the organization you started. Why did you start it, and particularly in the Norfolk area?
Well, my daughter was first diagnosed with the illness when she was just 4 months old. She had a brain hemorrhage when she was 4 months old. We did not know that she had the illness.
Wow.
We were completely blindsided. We rushed her to CHKD, and because she was vomiting and she was looking like she actually had a bad flu, but her soft spot on her head was raised, and so the pediatrician said, please go to CHKD and find out what this really is. And we went and we had a scan done of her brain, and they came out and told us, your daughter has tumors all throughout her brain, and one of them has grown so large that it needs to come out today or she's not going to make it. Yeah. So I got introduced in a very dramatic way to the illness. Most people don't get introduced that dramatically. For us, it was huge. And Julia, my daughter, actually wound up having a brain hemorrhage once a year for 4 years, and a subsequent brain surgery once a year for 4 years, because the only way to treat a cavernous angioma at this point is to take it out with a brain surgery. And depending on where it is in the brain, that can cause more deficits just because they have to get through brain tissue to get to the cavernous angioma, and in some cases they wind up being inoperable because it's just, they would do so much more damage trying to get to it than the benefit they would get from taking it out. So that's how I got introduced to it. I, like most people nowadays, this was back, she was first diagnosed in the year 2000, but like most people nowadays, I went to the internet looking for information about the illness, and there was nothing. There was absolutely nothing.
I was quite confused when I went to look for it as well.
Yeah, and part of that, and the confusion is in part because there are 3 different names for the same illness. Cavernous angioma is the one that we use. Cavernous malformations is another name that's used, and cavernoma is a third name that's used. And your doctor could tell you any one of those names, depending on where your doctor was trained, when they were trained, they learned a different name for it. So folks don't always come to it with knowing the same name for it. But just back then too, there just was nothing. And so, living with Julia, living with her for about 3 years, I wanted her to grow up knowing other people with the illness. We didn't know anybody. There was no way to meet anybody. So I figured that the only way to do that, and my background is as a clinical psychologist, and I had a little bit of in-hospital experience. I had some neuropsychology background, so I understood the medical literature a little bit better than other parents might be able to. My thought was that what we really needed was some sort of an organization. And so I contacted the physician, scientist, researcher who wrote the textbook. And he didn't know me from anywhere. His name is Issam Awad, and he's right now at the University of Chicago. He didn't know me from anywhere. I emailed him one morning and said, "Hi, I'm a mom in Virginia, and I want to start an organization to help patients with cavernous angiomas. Awesome. Can you give me some ideas for what I should be doing?" And he wrote me back that afternoon. That's and awesome. He said, "I think you should, put some educational information out there, because he knew there was nothing out there. I think that you should raise some public awareness, and I think that you should help researchers in whatever way you can. And I would be happy to be your scientific advisor."
Wow.
So he and I got together and we wrote all of the information that's on the website. I wrote it first, he reviewed it and revised it. My brother was the first webmaster. We put up the website, and along with the website came what we called a community forum, which was a bulletin board based way for patients to meet each other and talk. And that was what it took. That was all it was needed to get things rolling. It was like if you build it, they will come, and they came. So this has been 10 years now, and the organization has grown phenomenally.
So what does your future look like?
Oh, the future for the organization?
Yes, really quickly. We have to wrap up. Get ready to wrap up.
For the organization, we're looking for a cure with medications.
Awesome.
We are helping our researchers to collaborate better. We are sponsoring patient meetings. We are, and I've been out on the road meeting patients all over the country. So. Yeah.
Well, thank you so much. This was not only something that I didn't know before, but it's so much information about it. So thank you so much for joining us and sharing your story with us.
Thank you for having me.
Thank you so much.
Thank you.
Thank you for joining us. You have a good one.